talk about for legalization of abortion. I want to begin my speech by telling you a news that happened in Bogota, Colombia. A little baby of 7 months arrived to the Vista Hermosa hospital with features of malnutrition. Even though the nurse and doctors did the best, the little child couldn't regain his health, and he died. And I will ask you something. What will you do if you had the opportunity to not have that child? Would you quit his suffering or let him live? That's why I agree with legalized abortion. Have a child without being prepared has severe economic, physiological, and health consequences for the mother and child. Up to 500 women die from up to 500,000 women die from complications related to pregnancy and childbirth each year. Pregnancy is the leading cause of death among young women between the ages 15 to 19. Babies of teenage mothers face a significantly higher risk of dying than those born to women aged 20 to 24 years. Some 16 million girls aged 15 to 19 years and about 1 million girls under 15 give birth age year, mostly in low and middle income countries. The latest figures report that there are more than 400,000 babies of teenage mothers. Picture of malnutrition deficient in essential nutrients for the proper development of the baby. An increased number of spontaneous abortions, premature births, a large numbers of babies of teenagers born before 37 weeks gestation. Their babies are underweight because the immaturity of mother's body makes their others not fully developed. Adolescent moms have more children with health problems and development disorders. In case of pregnancies of girls under 15 years, the baby is more likely to be born with malformations. Each year, there are approximately 15,000 complaints of rapes in Mexico. Only 20% of rapes are reported. We can calculate an average of about 700,000 rapes every year. In the case of sexual abuse in adolescents, 8.2% of women between 14 and 18 years reported having experienced some form of sexual abuse. By 2009, between 1.2% and 1.8% of teenagers had their first sexual intercourse forcibly. This means that 120,000 teenagers who are women are raped in Mexico every year. In 2008, poverty in Mexico revealed that 50 million Mexicans were not enough income to cover their basic needs regarding health, education, food, housing, clothing, and public transportation. There are 6.3 million teenagers who are women, in which 52% are poor, which is a 3,400,000. Mexico is decriminalized since 2007 at the request of the woman until 12 weeks of pregnancy in Mexico City, but penalized in 18 of the 31 Mexican states constitutions. The abortions performed under unsafe conditions kill about 70,000 women a year. In countries whose legalization in this area is more restrictive. Okay. With all this data, we can conclude that having a baby in poverty conditions or be a teenager mother has serious consequences, and not always have a child of their own volition, as in the case of rape. A lot of women are raped and they are not blamed for having a child in poverty or have a child in poor health because they are teenagers. It will drastically decrease health problems in teenager mothers and premature babies. Also decrease the percent of malnutrition in children. I think that we need to legalize abortion and thus reduce mortality of pregnant adolescent women. Moreover, diminish abortion deaths, as many women miscarry in inappropriate because being illegal places.
Thank you. You wait until he finishes and then you have 4 minutes to reply.
But you were for abortion, right?
Please, oh my God.
Yeah. No, like, sideways, please.
Okay.
No, it's not, because when you use the computer, it's going to be more difference. Abortion is the ending of pregnancy, by removing a fetus to embryo before it can survive outside the uterus. An abortion we cannot occur spontaneously is also known as a miscarriage. An abortion induced abortion, or at least we can truly induce miscarriage. The word of